With us now is family physician Dr. Jennifer Caudle. Doctor, thanks for being with us. So when you think about this,
Thank you.
2 weeks in a cave, more than 2 weeks really, oxygen levels dropping, little food. There's of course the risk of airborne bacterial or fungal infection. How surprised are you to learn that the boys are all healthy?
I have to say this is remarkable. And I know that all of us watching this over the last couple of weeks, I mean, we're all completely overjoyed. But as a physician, I have to say it's really remarkable that they've come out and seemingly they're all healthy.
And what would you have expected?
Well, you know, there's a lot of things that simply could go wrong, which many of them we've thought about over time. You know, we know that the boys and the coach were dealing with lower oxygen levels in the cave, and that can cause problems in and of itself. But the malnutrition and the dehydration, that can certainly cause problems. The weight loss, we know that they might have lost on average 4 to 5 pounds or so. But then the mental health issues that we've been talking about, the concerns about post-traumatic stress disorder, anxiety, etc. And then probably one of the bigger things is infection, right? They're down under in a cave. We're worried about water. We're worried about infections, fungal infections, bacterial infections. So honestly, the number of things that literally could go wrong here are numerous.
The medical staff said earlier that some do have a higher rate of white blood cell count. Why would that be?
Yes. So white blood cells are sort of part of our complete blood count. It's one of the blood cells that tends to be mobilized when our body needs to do something. There's a number of reasons why a white blood cell count might be elevated in people. You know, certainly main reasons would be infection or inflammation. But honestly, we can actually have a higher white blood cell count just from physical or emotional stress. There are other things that probably are more, rather less likely in this case. Allergic reactions can do it. Medications can actually increase the white blood cell count. But I would say inflammation, infection, and sort of a stress response from emotional and physical stress are probably the main reasons we would see that.
And I'm just watching this video, seeing these boys, these young teenagers, some of them as young as 11 years old, sitting there. They're, you know, physically strong, it appears, but they are starting with a restrictive diet, soft foods before the normal diet. Family members do have to wear a special cloth to prevent infection. What else do you expect in terms of the recovery process, and how long might it take?
Right. So I would say in terms of how long it takes, based on some of the press releases that have been released, it seems like the hospital is going to take each case, or might take each case case by case, which to me sounds like a good idea, because certainly every child and the coach, they're all different from one another, might have different underlying conditions, and all of that might determine and change how fast one recovers from the other. But I do certainly understand and agree with the idea of advancing the diet, starting slow. Remember, they haven't had really proper nutrition or hydration in a while, so you want to start slow and make sure that they're eating properly, their stomach can tolerate it, and then advancing the diet. I would imagine certainly mental health evaluations, whether they're doing counseling or sort of other evaluations, and still continuing to look for signs of infection that may appear later on down the line, or other abnormalities that may come up now that they're out of the cave, which in and of itself was a traumatic and stressful incident. Sometimes we see things popping up a little bit later. So, you know, I'm delighted that they seem to be doing so well, and you know, we're all certainly saying prayers, but that's what I would imagine would come down the line.
Well, we are rooting for them, no doubt. Dr. Caudle, thank you very much for your expertise and for sharing with us.